All right, good morning. This is Senate Health and Welfare, TGIF, May 2nd. And we are looking at a bill that's returned to us from the House, S-36, and then we'll move on to some of the bills, the House bills that we've been working on, H-91 and 266. Thank you for being here, Katie.
You're welcome. Good morning.
Good morning. So can you walk us through
Sure.
what's happened?
Sure. Katie McLean, Office of Legislative Counsel for the record. I'm going to start by showing you what you passed, because it's not a strikeout coming back to you, so it might just help to have that frame of reference. So this is S-36. And if you remember, we spent a lot of time right before crossover talking about high intensity residential treatment and low intensity residential treatment. And there were two different sections addressing Medicaid reimbursement for these types of residential treatment. So your sections 1 and 2 right here have not been changed.
Okay.
So those are coming back to the same. You also had a report on a Medicaid payment model. That has not been changed. So that's coming back to the same.
That's really the heart of the bill. That's good.
And then you had language that you were asked to put in around public inebriates.
Yes.
So this is the language that you put in these sections 4 and 5. And the effect of the amendment that Human Services did is the same, which is to repeal the language that hasn't taken effect yet, essentially. But they made a change and added a report. So a change you'll see is we use the phrase public inebriates. But as I looked at the statute, that term isn't actually used in the statute. It talks about people who are incapacitated. So to use more respectful language, the House Human Services Committee updated this, what's essentially just a descriptor to use the terminology in the statute. So that these are really the only changes you're seeing to your language that's coming back, but they have additional language. So I'll go through that next.
So they updated the language on the public inebriate
Yep.
and kept the repeal in place.
This is intact.
Okay.
And I believe the effective date is still intact.
Uh-huh.
And I will switch doc.
So sorry to interrupt. So folks who are inebriated in public will not be incarcerated. That remains.
So what this allows is for somebody to be not incarcerated, but to have like a lockup in a correctional facility. Language to do away with that would have taken effect, or currently is set to take effect July 1, 2025. And this language gets rid of that option. So this maintains the use of DOC as a potential lockup facility. Yep.
Thank you.
Okay, so I'm gonna switch documents.
Wait, it keeps DOC as a potential lockup.
It does
Yes.
keep it as a potential, yes. Okay, next document. Here is the House proposal of amendment. So this first instance of amendment, by striking out public inebriates, inserting persons who are incapacitated. This is in section 4 of the underlying bill. This is what I just was pointing out to you. That descriptor language about what is being repealed is being updated. So that is that change. And then there are 2 new sections added to the bill. The first section that's being added is a report back on services and programming for persons who are incapacitated. The Departments of Health and of Mental Health, they have an existing plan to expand services and programming for persons who are incapacitated pursuant to the underlying statute. And this directs them to prioritize Chittenden County in that plan. And I think you'll hear more from Representative Bishop, but there was conversation about Chittenden County as the place in the state where there is the least capacity and the highest need for services. And subdivision 2, on or before February 15th of this coming year, the 2 departments shall jointly provide a presentation to the policy committees describing efforts to expand services and programming for persons who are incapacitated pursuant to subdivision 1 of this subsection. And then another report, also February of this coming year. This is from DOC. They shall provide a presentation to the policy committees describing efforts to reinstate the practice of connecting persons who are in a correctional facility due to incapacitation with appropriate community-based substance use recovery providers. So again, there's testimony upstairs that prior to COVID, there had been a better linkage between people who were incapacitated in a correctional facility with services once they left the correctional facility. And so this presentation is asking how those efforts at that linkage can be put back in place. And then, sort of changing topics entirely, this is a report on the Human Services Board proceedings. You may not know this, but there is a bill on the wall up in Human Services looking at the process and procedures around the Human Services Board, which is a fair hearing board for many programs in AHS. As the committee was taking testimony and diving into that, they were sort of poised to move a bill this year, and then they decided they could use additional information before they moved that bill. So this report is to collect the data they need to build that bill for next, I don't know, January, February. So this would come back to the General Assembly on December 15th of this year. AHS, in consultation with the Human Services Board, Office of the Attorney General, each of the agency's departments with cases before the Human Services Board, community partners, and individuals with lived experience as appellants before the board, shall submit a written report to the policy committees, providing the following information and recommendations regarding proceedings before the board. A proposal that attorneys representing the agency or departments participate in training that balances the attorney's ethical obligation to zealously represent the attorney's client with the respectful, trauma-informed treatment of appellants. An analysis of varying appeals processes specific to the agency and each department with cases before the board, including proposals that any legislative action necessary to improve consistency. Top of page 3, a proposal to identify and collect currently unavailable data in a manner that ensures uniform data collection across the agency and departments with cases before the board, including data regarding cases resolved prior to reaching the stage of hearing officer or full board involvement. Recommendations for resolving potential appeals prior to reaching the board and any other recommendation requiring legislative action. So that's sort of part 1 of this section. And then there's also a report requested or required from the Human Services Board in consultation with other entities. So the first report is coming from AHS in consultation with entities. This one is the lead is the Human Services Board. So in this report, it would include a proposal to improve understanding board processes and accessibility to appellants, including the use of media and graphics to explain what the board is and how it operates. A proposal for the exchange of periodic feedback as part of a continual quality improvement process between the board, agency, departments appearing before the board, Office of the Attorney General, Vermont Legal Aid, and other relevant stakeholders. An analysis of how to enable an appellant to present a personal narrative without jeopardizing the appellant's case or disrupting the legal obligations of the board and the attorneys representing the agency or departments appearing before the board, and recommendations to improve the reporting and analysis of data to the General Assembly, including information related to appeal requests resolved prior to reaching the stage of hearing officer or full board. So that is the substance. And we have a sentence or a phrase on line 7 that we're renumbering the rest of the bill to be numerically correct. That basically means that the effective dates are now section 8. And then on passage, the bill would be retitled to be an act relating to the delivery and payment of certain services provided through the Agency of Human Services, services for persons who are incapacitated, and Human Services Board proceedings.
Wow. But good. I mean, I can remember going through kind of a review and assessment of the Human Services Board a few sessions ago. So it probably is time to do this. Representative Bishop is here. So questions for Katie first, and then maybe you'd like to come up and make a few comments on what's here.
Sure, I think Katie covered it very well, but I'm happy to address any
Yeah, no,
questions.
like
that you all have.
us too.
Sure.
Any questions for Katie? Thank you. Okay, good. Representative Bishop, welcome.
Thank you. Representative Doug Bishop, I was the bill reporter on behalf of Human Services.
Excellent.
So, as was explained by legislative council, what came to us has pretty much come back to you intact, the first part, other than the language change. And with respect to the public inebriates, we concurred with the repeal, but took considerable testimony. I think we had 10, 11 witnesses come in to discuss that aspect of the bill. And while there was consensus about best practice of using the public inebriate programs, there was also consensus that there are instances where the preservation of DOC as an option was integral to the wider set of options that are available. And really, two things driving. We heard some very compelling testimony from medical staff from emergency departments, where unfortunately, too often as a default, someone who's, in this public inebriate now, persons who are incapacitated situation, they get housed, if you will, in EDs, which is really not an appropriate setting if there isn't a medical issue to be addressed. And in fact, for the person who's incapacitated, being in that inappropriate setting, they become agitated, they can end up with a criminal charge where they didn't have one to start the process.
We've heard about that.
Yeah.
Thank you, Madam Chair. May I ask a question? I mean, I would posit that neither environment is really appropriate for the situation, but I also remember we had a joint hearing a few summers ago, and it seems like a lot of the inebriate programs have gone away, right? Or so
Support services.
They have, that's where, maintaining as an option, particularly for areas where they don't exist, the DOC as an option was part of it, and then the inappropriate setting. And we would concur that DOC is not the best, is not where we really want this to take place. So the Department of Mental Health came and has a 2-year phased plan to try to rebuild the public inebriate programs. And so that's why we've asked for them to come back and do a presentation early in the next session on the progress towards that. And because of those of us from Chittenden County would be familiar where Act 1 used to be in place and is no longer. So the increased pressure on the use of DOC or the EDs caused us, when we saw Chittenden County in the second phase of the 2-phase plan, we asked them to prioritize that in this legislation, just because it's putting the greatest pressure on DOC, EDs, et cetera, due simply to numbers. And so that's why that prioritization is there. We don't like in these bodies to call out any one area of the state over another, but that's reality where the pressure is coming from there. So we want to remain focused on our oversight and accountability roles on this 2-year plan on rebuilding public inebriate programs, but maintaining DOC where needed. And so the second part, I said that was the testimony from medical staff, but also from providers who are running public inebriate programs. They also testify to the fact that sometimes DOC just is the option that needs to be available when someone's not and behaviors are not appropriate to be in pit at a pit bench.
Okay. Good. I like it. No, the good work on this, I think, and I think it's helpful to just repealing it is one thing, but having options is really important.
And
Moving away from DOC.
yeah, and I think I saw some head nods when there was reference to the trying to work with DOC, and they seem eager to do this to reinstate what they used to do by practice before COVID, is connecting people with community services upon their after the end of their 24-hour hold. So we'll see, we'll look at that as well in the start of the next session. Turning to the last section.
Yeah.
So the Human Services Board, basically what we were hearing, this was a separate bill initially, as was referenced by the Legislative Council, that Representative McFawn had brought, and we started diving into it and then saw this as a vehicle to help us garner some more information before we revisit it at the start of the next session. But we're, to boil it down, trying to address a power imbalance when something comes before the Human Services Board, whether a hearing officer or the full board. The DCF, the other instances, they're represented by either in-house counsel or an assistant attorney general, and 90+% of the appellants are coming pro se without an attorney before this. So the introduction of evidence, what's appropriate, what testimony is relevant, all of this is not something that's in the wheelhouse of your average appellant. So we're just trying to see if we can identify ways to level the playing field a bit. I think I'll tell a very brief personal story. I have a law degree, used to practice. It hasn't been, it's been a number of years. I remember getting in a very minor fender bender with someone. As we exchanged information, I wrote my insurance information on the back of my business card, figured that had all my information, gave it to this young woman. She almost started to hyperventilate. Oh my God, I hit a lawyer. Oh my God, I hit a lawyer.
Oh, God.
So I think can be a natural
Wait,
apprehension of someone getting into a setting where they know someone who has had formal training, and they just feel that imbalance. So that's what we're working.
Did you
through.
talk with legal aid?
Yes.
Yeah,
Yeah, we
okay.
had.
Yeah.
Again, I think we had 8-10 witnesses on this aspect of the bill as well, hearing from family members who are working on behalf of their adult child, to get services and the challenges they face. We heard from attorneys within AHS. We heard from the Human Services Board, from their hearing officer, from their chair, and from legal aid as well.
All right. We're good, I think. This is helpful. Thank you for
Yeah.
being available.
Yeah, of course.
Senator Douglas has a question.
Yeah.
I assume AHS is fine with the reports, they have the capacity and everything.
Yes.
Okay.
We're good. Thank you.
Yeah. So,
Good to have you with me.
thank you. And I'll even get the floor on time.
All right. So committee, this is up on the calendar. I can report today. Would you like to have a conference committee on this, or should we concur with the House proposal?
I'd like to get in there.
Well, those who would like to concur, straw vote. Okay. Larry, are you okay with concurrent? Yeah, but I think so. They've done a lot of good work on this. It's helpful. And the Human Services Board has, it's always been an issue about the power imbalance. So this may get further along. Okay. Katie, thank you. So we can move on. You can come back. Okay. So just to say, the draft that Katie's going to show us is rough in terms of our decision making. I'm not talking about the draft, or about the decision making. Sorry, what's here. So we'll go through it and see where we are. Okay, thank you.
I'd like to say I brought you something to hate. So hopefully you'll find some nuggets that are useful, but there's lots of room to make changes after the committee has.
Yeah, we have a lot of decision making. I just say that we've been through part of the bill, and the cafeteria group has been through part of the bill. And so what this represents is some of the comments that we've made in committee. And then our next step will be to get some feedback on the second part of the bill from folks who are engaged in this work, the VCAPs, the community organizations, shelter organizations, and others. And so then we'll look at the second part of the bill and we'll get another rough, and then we can go through the bill and have some more specific information moving forward. That's where we are.
Sounds good. So you have draft 2.1 on your website. The findings and legislative intent are this, well, it's just findings, but saying there's a change in legislative intent. So I'm gonna skip ahead. I should say
Do you have that up on screen?
oh, do I not?
Oh,
Oh, that would be helpful. Thank you.
we can have.
It was on my screen, so I felt,
Oh, yeah,
like we
so
were all set.
you're looking at it.
okay. So, I'm moving along to page 3. This is the legislative intent section. And you'll see there's changed language at the top of page 4. And this is to reflect the fact that, the decision in this committee is to sort of tier how VHART's implementation takes place, with money moving from emergency housing in fiscal year 27 and money moving from HOP in fiscal year 28. So now this sentence reads, it is the intent of the General Assembly that VHART replaces the provision of emergency housing through the General Assistance Program beginning in fiscal year 27 and the HOP program beginning in fiscal year 28. Okay. As promised yesterday, there are going to be tiered effective dates with sections amended multiple times. So in this section, this takes effect this year, July 1, 2025. So what takes effect this year? You're creating a chapter, the VHART chapter, with the short title. You have a purpose statement with a new purpose at the top of page 5 to reduce reliance on the use of hotel and motel rooms to shelter participating households and expand the use of emergency shelters throughout the state for this purpose. You would have a definition section taking effect this year. And there's a change to the definition of household to mean individuals and any dependents for whom the individual is legally responsible, was domiciled in Vermont as evidenced by an intent to dwell in Vermont and to return to Vermont if temporarily absent, coupled with acts or acts consistent with that intent. Just taken from other language, Title 18. The other piece that would take effect this year is the establishment of regional advisory councils. Sorry, I have a may I pause for a moment?
Yeah.
Okay. My apologies. Okay, so the next piece that's taking effect this year is the adoption of regional advisory councils. So this language would read, each community action agency shall convene a regional advisory council whose membership reflects growing diversity among Vermonters, including individuals who are Black, Indigenous, and persons of color, as well as with regards to socioeconomic status, geographic location, gender, sexual identity, and disability status. Members of an advisory council shall include organizations providing services in the region. It may collaborate with individuals with lived experience of homelessness, community partners, state partners, housing providers, local housing coalitions, providers of coordinated entry, continuums of care, faith-based organizations, and municipalities in the region served by the Community Action Agency. And the duties of, or the responsibility of these groups is outlined in B. Each regional advisory council shall provide advice and recommendations to the Community Action Agency and its region regarding the design and implementation of this program. The work of each regional advisory council shall be informed by Regional Planning Commission's housing targets. And subsection C.
Any questions on that? I mean,
Well, do you want to wait? Because the only thing I wanted to bring up here is that I heard from a colleague that she felt pretty strongly about the municipalities being included in this work. It does say may collaborate with.
Yeah, I've got that comment down too, but so let's go through it, but I know that municipalities, I'm also concerned about regional planning commission housing targets. So there are a lot of these little fine tuning things that we can do, so write them down. And I've got that message, so,
All right,
yeah.
thanks. Okay. In subsection C, each regional advisory council shall meet on at least a quarterly basis. And in subsection D, the regional advisory council shall have the legal and technical support of the department. So that is what is taking effect July 1, 2025.
Okay.
Basically, you're creating a chapter and sort of the introductory chapter language so you can create the regional advisory councils early.
Mhm.
The more robust portion of this chapter takes effect on July 1, 2026. So on July 1, 2026, we're updating the definition of community action agency. So it means an agency designated pursuant to Title III, or the entity or entities otherwise authorized by the department pursuant to 2205 of this chapter to fulfill the duties of a community action agency under this chapter. So I'm just going to pause and say what that means. In the version of the bill that came over from the House, and in this version as well, there's a sentence that if a community action agency can't fulfill its responsibilities under this chapter, that the department could select another community action agency to do that work or select another entity. However, the chapter continues to use the phrase community action agency and doesn't recognize that in some circumstance it could be another entity doing that work. So this is sort of a catch-all so that if another entity happens to be selected, that the term community action agency in this chapter only would incorporate that particular entity. And it's added a year out after the definitions are adopted because that sentence itself isn't adopted until 2026. So it doesn't make sense prior to that. Okay. So now we have a section 2204. This is establishing the VHART program. This sort of sets forth the components of the program. So VHART is established in the department to provide services to households that are homeless or at risk of becoming homeless, to the extent funds exist. The department shall select and contract with a statewide organization that has population-specific service experience, to specifically provide or cause to be provided supportive services to and shelter to those households that are experiencing or that have experienced domestic or sexual violence. I'm going to strike that specifically. It feels wordy now that I'm just looking at that.
Which one?
Line 9. Population specific service experienced, we'll just strike specifically to provide.
You got it.
And then in subdivision 2, all other participating households shall be served by or through a community, that should say community action agency, not community-based, a community action agency responsible for a geographically distinct region of the state. Community action agencies participating in the program shall provide or cause to be provided supportive services, extreme weather event shelter, and emergency shelter. And then we have the language about the authorization process and the reauthorization review in 2205. The department shall authorize a community action agency. I don't know why I will figure that out. Where was I? The department shall authorize a community action agency to serve or cause to be served households that are homeless or at risk of becoming homeless in a geographically distinct region of the state if it meets the criteria in this section. If a community action agency cannot fulfill its responsibilities under this chapter, the department shall work with other community action agencies or other appropriate community entities to ensure there's not a gap in services in a community action agency's region. That's the sentence I was referring to.
That's a good question.
Yeah.
You probably explained this, Katie, and I'm just Friday, so that's my excuse, but why, sometimes we're using cap, sometimes we're using call.
We should be using community action agency. That's
Okay.
why I paused, because one of them says community-based
Okay.
action agency, that which should just read community action agency. And then I was pausing because it seems like after the editing process, community action agency is hyphenated in some places and not in others.
Okay.
So I've made a note to double check that.
But we're no longer talking about caps.
Oh, the title, when we get to the bottom of the bill or the bill that came over from the House, there's a whole section that amends the community action agency chapter. Human Services went back and forth a little bit and decided that the title of these entities should be community action agencies. So I have, it wasn't,
It's either CA or CAT.
Are they gonna have?
It wasn't-
Program.
it wasn't CAP before that. I had to look and see what it is in statute. Community Service
Yeah.
Agency.
We now have two cause.
Yeah, I know,
Critical access hospitals
that's why I'm
and community action
getting-
agencies.
So one CAA,
Yeah.
one CAH.
But I mean, are the caps gonna have to change their name? Like,
No, it's community action programs.
Community
Right, their
action
official
program.
language, at least when I was there, is it's a we were Central Vermont Community Action Agency.
Right.
As EVCAC, when I was on the board, it's now Capstone, I don't know.
Yeah, they all have their little names.
In statute, it's Community Service Agency right now, and it sounds like nobody uses that title, so it's coming into conformity with what.
When I
needs to
Google
be used.
Vermont Community Action Agency, it comes up Vermont Community Action Partnerships. It's a little confusing.
I'm wondering if the distinction is, that this refers to each individual agency versus a partnership or collection of programs.
Okay.
Yeah, but I'm happy to.
So this is the
Take feedback
discussion
on
that
that.
will continue. I get that.
Okay.
CAs and CAPs.
Oh,
What?
yes.
That's cute. Good morning. Good morning. Do you need another one? No, I've been here since 8 o'clock. No.
I will help get you through.
Salvage. The ship. Which I think is floating.
Okay, so where are we? So we
We're-
had a short diversion.
Yep, we're on page 9.
Mhm.
This is where we're talking about the authorization and reauthorization process. We're on subsection B. And this is the list of things, so the community action agency providing or causing to provide services in accordance with this chapter shall have. So if you're trying to compare the two versions of the bill, the House version had this under community action agency responsibilities. So now I've pulled this into the authorization portion of the bill with some changes. So it shall have existing or planned infrastructure to support households in the region, including an established leadership team, human resources staff, and the ability to receive grant funding and issue subgrants. The ability to meet the department's reporting requirements, including having a past history of reporting compliance. The ability to perform the services required pursuant to section 2206 of this section. That's new. We haven't looked at 2206 yet.
Go ahead.
The ability to perform services, it seems vague to me, just.
So we'll circle that
I already did.
and yeah, we'll fine tune the language and we'll talk with the council about.
Okay.
And do you feel that ability to do it is?
I mean, what you're looking at, what the department would be looking at is, does maybe the capacity instead of ability, if that is
That's
a better term.
Yeah, let's
Okay.
do that. Good.
Yes.
Because if it's up to the department's discretion, that's fine.
Okay, subdivision 4 is intentionally broad. Any outcome measures established in this chapter. We discussed yesterday that the performance measures are coming back to you. And if you choose to adopt them, then we would bring them into this chapter and have a cross-reference here. But at this point in time, we're just saying, acknowledging that there might be performance measures.
While you mention that, they'll be coming back to us and with performance measures, just as one of the things coming back to us.
Mhm.
And this is just a thought going ahead. If they come back to us and we say, oh, this is great. What would be good to avoid would be having to pass legislation that says, yes, go do it. But rather have something that says if the legislature doesn't act by a certain time, that it goes into effect. But think about that. I don't want to muddy the waters here, but it just, how can we avoid having to have a full legislative, a bill on some of this when is all worked through? So
There are so many reporting pieces that have coming back to you before the program implements, or is implemented.
yeah,
That I would suspect the performance measures is a small aspect of the other.
yes, right. I agree. And so it's just a matter of how many of these things are we going to have to put into another bill? We'll just think about that.
Okay. Could say established in this.
We don't do it now.
Okay.
It's just a thought.
Right, subdivision 5. Community connections with other providers in the region, including local housing coalitions, housing providers of coordinated entry, continuums of care, faith-based organizations, and providers of services to individuals who are older Vermonters, individuals with disabilities, substance use disorder, or mental health condition, individuals re-entering the community after incarceration, individuals transitioning from the care and custody of the Commissioner for Children and Families, and families with children, and the ability to provide plain language communications to households receiving services. Okay. And subsection C, this is the language about reauthorization. Not less than every 3 years, the department shall conduct a reauthorization review of each community action agency, providing or causing to provide services pursuant to this chapter. An organization that no longer meets the requirements in subsection B of this section, or that has failed to meet the needs of households in its region that are homeless or at risk of homelessness, may be subject to remedial assistance from the department, or the department may not reauthorize the community action agency. Okay. Next, 2206 is VHART services. This pulls together about 4 sections in the House bill that came to you. So this sort of gives you a compendium of all the services that are within the VHART. So in paragraph A, this refers to the network, that the department shall enter into an agreement with a statewide organization with specific population-specific experience serving households that are experiencing or have experienced domestic and sexual violence. The organization shall provide or cause to be provided various shelter and case management services that support households. And then, let's change B on line 18 to be community action agency. Sorry, it's inconsistent.
Draw it out.
We're gonna have a knockdown.
Okay. Each community action agency shall offer or cause to be offered in collaboration with community partners each of the following services within its region. Supportive services, including intake assessments and services for diversion from homelessness, which may include regional intake shelters, household needs assessments, individualized household plans to address identified needs, assistance obtaining and retaining housing, including financial assistance, referrals to other services and supports, including economic benefits, peer supported services, landlord-tenant outreach, education and conflict resolution, housing navigation services, healthcare assistance, including treatment for mental health conditions and substance use disorder, job training and employment services, services related to disability and independent living, advocacy, program, progress, monitoring and interventions, and then next is extreme weather, the operation of extreme weather event shelters, which may include time-limited congregate accommodations and may be provided through agreements with municipalities or other entities using available data and considering geographic access to prioritize funding for this purpose. And the operation of emergency shelters in the House version. This breaks emergency shelters into two categories. This version collapses those categories and just calls shelters emergency shelters. The operation of emergency shelters in a manner that built upon the federally required community planning process and prioritizes households in need of services of an emergency shelter, which may include community-based shelters, temporary use of hotels or motels, lease agreements for full or partial use of an existing building, need-specific shelter arrangements, master grant leases, the development of shelter capacity, or other arrangements or combinations of arrangements that comply with the intent of the chapter.
So seems like a lot in this.
I
That-
sort of collapsed the language that was in the emergency shelter had been split into two categories and had a list of potential options for what could constitute emergency shelter in each list, and I collapsed those into one big list. So
And what runs through my mind here is, the relationship between, I'm gonna say CAPS. The CAPS and the folks within the CAPS, of all of the shelter programs, et cetera. And the work that they do to, have build more shelters, have hotel blocks. I know that's the next section, but, and then, the question about municipalities and regional planning commission goals for building housing. Do we have anything in here that links them? I mean, it's not the first thing they do. But along the way, having the ability to connect with those organizations. Once the need is identified in Troy for specific housing types. Once that happens, linking in with the municipality and the regional planning commission to have some. Get some work done to make it happen. So do we have anything in there that sort of allows for them to to direct some of that work?
this was just meant to list the
Yes,
services.
that's
but
the
there-
things that they're doing. I got it, and it's there. I know,
Yeah.
there's a lot there. It's huge. And it implies a lot of work on the part of the CAS. But then they ought to also have some. Not here necessarily, shouldn't be a requirement, but somewhere in here, giving them authority or responsibility or.
You have the regional advisory committees that you're requiring them to
Yeah.
to take.
Well, just a thought. I'm gonna
Okay.
just keep going, but it's just I don't know where it fits. I
Okay.
really don't.
I
don't know
will
What
hold
the
on to
cats are
that.
gonna like or not like about it, but it's something that I think would be helpful statewide, but.
I'll try to keep that in mind. I would also say there's probably nothing that would prohibit that type of collaboration from happening. Let's keep going and I'll sort of
Yeah, we'll do it.
keep that thought. So next I've moved up the section on use of hotel and motel rooms. There's a new subsection A. It is the intent of the General Assembly to decrease reliance on hotel and motel rooms for emergency housing. Annually, as shelter capacity increases in each region of the state, the use of hotel and motel rooms for emergency housing in that region shall decrease by the same percentage as the increase in shelter capacity. Annually, as part of the department's budget presentation, it shall provide data pertaining to the percentage of increased shelter capacity from the previous fiscal year in each region and how that increase impacts the corresponding hotel and motel room usage for emergency housing in each region pursuant to this subsection. Then you've changed sort of
This is a responsibility of DCF.
to provide that data during their budget presentation. But it would ultimately be up to the General Assembly to decide they agree with the proposed reduction in light of the increase of shelter capacity.
Okay.
That'd be something that you would build into the budget each year. Yeah, okay. In subsection B, if hotels and motels are used to provide emergency shelter pursuant to this chapter, hotel and motel operators shall comply with program rules and the following rules, the licensed lodging establishment and fire and building safety. And subsection C has been renumbered Annually, the department is to propose hotel and motel rates as part of its budget presentation for approval by the General Assembly. A community action agency shall not pay or cause to be paid with state monies a per room per night basis that exceeds the rate approved by the General Assembly. In subsection D, if a hotel or motel room is being utilized, this is existing language from the House, the community action agency shall enter into an agreement for the use of blocks of hotels and negotiate conditions for use of those blocks and prioritize the use of hotel and motel room agreements over individual per room per night hotel or motel room use. Unless it's not appropriate to meet the household needs. 2208, the hard duties of the department. This is quite similar to the version that came over from the House. Swapping the responsibility. So it had said that the agency had statewide responsibility. This version says the department with oversight from the agency shall have statewide responsibility for meeting the intent of the chapter, including statewide planning, system development, and involvement of all the agencies department.
And we'll talk about that oversight and.
Okay. And then this is the
However, it does. Got it. Okay, I'll come back to it.
Okay, page 14. For the purpose of providing administrative oversight and monitoring of the program established in this chapter, the department shall maintain guidance. The earlier version may have said establish guidance, but I've moved the establishing guidance into one of the earlier report backs. So now this is just maintaining that guidance regarding extreme weather event shelters. When they shall be operated, including flexibility for regional weather conditions, and then maintain a website, the locations of all extreme weather event shelters, include as part of any review of community action of a community action agency required pursuant to Title III, the community action agency's ability to perform the requirements of this chapter. In subdivision 3, consult with the community action agencies and statewide organizations serving households that are experiencing or have experienced domestic and sexual violence to develop appropriate resource allocations and methods for adjustment, take into account available data, the budgets of community-based providers, and customary resource allocation methods, economic indicators, rate of homelessness, rental vacancy rates, and other variables as appropriate. Annually distribute funding to each community action agency and the statewide organization serving households that are experiencing or that have experienced domestic and sexual violence using the allocation formula developed pursuant to subdivision A up above. Or if the department and community action agencies agree, disperse joint allocation for all community action agencies, which the community action agency shall determine how to distribute among themselves. 4, provide support and technical assistance to the community action agencies, other community partners, and statewide organizations serving households that are experiencing or have experienced domestic and sexual violence. 5, identify specific administrative resources that could be transitioned to community operations. 6, develop and maintain standards for the operation of community-based shelters. Again, I moved responsibility for establishing those standards up in the timeline, which is why what would be codified is the maintenance of those standards. And then adoption of rules. You'll see that the numbering is highlighted because I pulled some pieces out to move up in the timeline, and that renumbering reflects that. 2209, regional planning and needs assessment. As part of the plan required every 3 years pursuant to Title III. So in Title III, that governs the community action agencies, there's a plan that's required every 3 years. So as part of that plan and the federally required planning and needs assessment for the continuums of care, the community action agencies shall develop a regional needs assessment and planning process in collaboration with community and state partners for the use in each community action agency's region to inform future plans addressing housing and homelessness in each region of the state. The regional needs assessment and planning process plans shall include addressing progress and reducing the number of households experiencing homelessness in the region, assessing the rate households placed in permanent housing return to homelessness and the underlying reasons. Identifying resources developed and utilized in the region to address homelessness and efforts to improve the equitable distribution of these resources in the region. Oh, slow down. Sorry.
Just a little.
Nope, thank you. I
Go,
appreciate it.
as you go.
I have a lot
You
of
speak
ground.
As you
I have a lot of ground to cover.
It's that we all do the same thing.
Okay, thank you. Reporting the rate of household participation with coordinated entry processes and case management services. Identifying system gaps and the funding needed to address those gaps, including periodic inflationary adjustments. And utilizing data, including Vermont's point in time count, coordinated entry assessment results, and community conversations. So again, this is part of the regional needs assessment that each community action agency would do every 3 years. And then in subsection B, every 3 years, each community action agency is to submit plans developed pursuant to this section to the department and a format prescribed by the department. Upon receipt of those plans, the department shall consolidate the results of these reports and submit the consolidated report to the policy committees. Previously, I had used the word aggregate to submit an aggregated report, and that suggested some anonymity that I don't know that was intended. So I think what was meant is to just bring all of those reports together.
So every 3 years, it's a report, talking about that.
Every 3 years is looking at the community action agencies region, assessing the needs in that particular region and coming up with a plan to address what has been assessed as part of the regional needs assessment. 2210 is a new section of the bill, reporting requirements. On or before the last day of each month, the department shall submit a report to the policy committees and joint fiscal committee addressing the number of households served through the program by household size, eligibility category if applicable, region, service provider, and type of service. Changes in shelter capacity since the previous reporting period. The number of diversions made during the previous reporting period. The number of households whose intake assessment indicated a potential need for services from each department within the agency.
So, with from each department, is there going to be anything in here about from the DAs or SSAs, services with the region?
They're not a report back, but there's language about providing service for DAs and SSAs.
Because this is where it would fit within that,
Okay.
from each department. Okay.
In subdivision 5, the number of beds available for emergency housing in each region of the state, with separate reporting on the number of beds available in nursing homes and residential care homes for individual whose screening indicates they could meet the clinical criteria for those settings, and the number of emergency beds available for individuals whose screening indicates they do not meet the clinical criteria, including low barrier shelters, beds for youth, and beds for individuals who have experienced domestic violence. So again, just a reminder of what we talked about yesterday, many of these reporting requirements were influenced by what was put in place a couple of years ago around report backs, and which the past few budgets have referenced as data points. Subdivision 6, the number of households that have been successfully transitioned to permanent housing since the previous reporting period, the types of housing settings in which they have been placed, and the supportive services they are receiving in conjunction with their housing.
At the end of that sentence, and the supportive services they're receiving, that be and any supportive services.
Are you up for?
No,
You're on 6.
yeah.
On page 18.
thanks. Yeah, and any supportive services. It's not, not everybody's in this. I mean, I suppose it's the same thing, but.
And just take any modifier out and just say, and supportive services they're receiving.
I think you're saying the opposite. You want the word any.
Yeah, I was saying, get rid of the any. I mean, I think actually it might have to achieve this in federal government.
Okay. So line 3 and any.
If there's somewhere in here where we're looking at services that are needed that aren't being provided.
I have gaps in services at the very end.
Huh?
Gaps in services at the
Oh,
very
there
end.
we go. Okay.
7, the outlook for transitioning additional households to permanent housing in the coming months, including an estimate of the number of households likely to be placed per month. 8, any state rules and local regulations and ordinances that are impeding the timely development to safe, decent, affordable housing in Vermont communities in order to identify areas in which flexibility or discretion are available, and advise whether the temporary suspension of relevant state rules and local regulations and ordinances or the adoption or amendment of state rules would facilitate faster and less costly revitalization of existing housing and construction of new housing units.
I like that.
That's from the act a few years ago. 9, an inventory of all subgrants issued by the statewide organization serving households experiencing or who have experienced domestic or sexual violence, and by each community action agency. And 10, gaps in services. So you'd be getting this particular report on a monthly basis until 2023. Nope, until 2030.
Back to the future.
Wait, where is that?
That is line. We haven't gotten there yet.
Okay.
It's updated. I'll
Okay.
flag it for you when we get there.
Okay.
19. What's happening here, if you remember, the regional advisory councils went into effect in 2025 when the chapter was very tiny. And now you have added all of this substance to the chapter, and I'm moving the regional advisory councils to the end of the chapter. That's what the renumbering is. And then adding language that members of the advisory council shall include organizations providing services in the region pursuant to section 2206 of this chapter. I think that cross-reference makes sense to reference the sections, but we can't do it earlier because 2206 doesn't exist in 2025.
Till later.
So that is the end of changes for fiscal year 26. In fiscal year 27, you're amending the purpose section of the bill, this proposes that you would amend the purpose section of the bill. In 2025, it would just say that the purpose is to replace the provision of emergency housing through the general assistance program. And this would add in and HOP and use funds and resources previously attributed to those programs. So because the HOP funding doesn't become part of the program until fiscal year 28, it doesn't make sense to reference the use of HOP funds for this purpose until that time. So this amends your purpose section to pull those funds in.
Remind me where there's the how HOP is integrated is in a reporting piece.
There is, yes, at the very end of
We
the
need to
bill,
make
there's
sure
a
that,
report.
because the biggest concern that I hear about right now from community partners is the HOP is the best run program in the state. We shouldn't change it. So having it continue through 26 and 27, it's critical. But then how? I mean, if we say if and when, but to say if and when or how the HOP is integrated at some point, that report has to come back.
Okay, can look at that. There is,
Yes, so that's later.
it's part of the budget presentation later. This change isn't if, this change is,
This is
assumes that it
happens.
is happening. Yeah,
But so with the question I have is, it is happening.
Mhm.
So my question is, we're gonna say, is there a how this happens? And here's there's some upfront planning.
Yeah.
Okay.
and
I know that'll be a big discussion. I know that.
And then we're amending this chapter again, 2030. And this is the reporting requirement section that we just looked at, right? What would take effect in 26 is monthly reports. This change would be every third month, so this would be quarterly. And then, because it's a less frequent report, it's no longer going to JFC. It would just be coming to the two policy committees. This is maybe a good place. Do you need to hear from Jen?
Not yet. She's
No.
on at 10:30.
Okay, my
You're good.
bill that was supposed to be on the floor, they are passing.
Do you
over.
have to go?
No, they're passing over it today, so
Oh, bless her
I
heart.
can take Jen whenever. I'm flexible. Okay. So next are implementation planning and can't speak. Implementation planning and initial regional assessments. So first is section 7, the implementation planning. This breaks into 2 separate reports. Implementation from the Department for Children and Families. So subsection A is the first report, October 1. B is the second report in January. And then in the next section, we look at an initial regional assessment process that the community action agencies would go through. And that's what we talked about, I think yesterday and the day before, that it would be sort of a 2-pronged process or a 2-tiered process to get that regional assessment done the first time. So first, implementation planning by October 1 of this year, DCF in collaboration with community action agencies, regional advisory councils established pursuant to 2204, and the statewide organization serving households that are experiencing or have experienced domestic or sexual violence shall submit the first of 2 written implementation plans to the policy committees and joint fiscal, outlining its initial plans for the implementation of VHARTH by July 1 of 26. Specifically, the first implementation plan shall include the process that community action agencies in coordination with the department shall use to conduct regularly occurring regional needs assessments and develop future regional plans. In subdivision 2, recommend performance measures to evaluate the community action agencies and the statewide organizations serving households that are experiencing or that have experienced domestic and sexual violence and carrying out their duties under Chapter 22, including the provision of any previously agreed upon information to enable the department to evaluate the services provided through grant funds, the effect on households receiving services, and an accounting of expended grant funds. Yep. And performance measures that may be specific to an individual region of the state or provider.
We could leave that S out and see if the draft.
And
Editor.
the editor stayed late to review this draft, so
No, let's
let her-
don't worry about it.
I'm incredibly grateful. And an accounting of expended grant funds. Okay. Also as part of the October 15th report, recommended eligibility for each of the services offered through Chapter 22. In subdivision 4, guidance regarding when extreme weather event shelters shall be operated, including flexibility for regional weather conditions. And a recommendation for the appropriate level of required intake and assessment processes for each type of shelter that a household may utilize. So this language that isn't highlighted, that was taken from portions of the House as passed version and added here in an effort to move up the timeline when you're receiving some of this information back. In subsection B, this is the second of the 2 reports. So on January 15th of 2026, DCF is to submit the second of two written reports. This comes to the policy committees, not JFC, because you'll be in session. Outlining its initial plans for the implementation of VHART to be established on July 1, 2026. Specifically, the second implementation plan shall include recommendations on the following. Most of these items were taken from
Okay,
the
the first implementation plan is
October 15th,
October, and then this is,
January 15th.
Okay.
And you'll see most of these items are not highlighted. That means they came from what is the implementation plan that the House sent over to you. Yep. Funding allocations among the community action agencies and other providers, including for services specific to households that are experiencing or that have experienced domestic or sexual violence. Additional state and federal funding and other resources identified for the program. Appropriate supportive services specific to the level of shelter a household utilizes, or whether the household is at risk of homelessness or experiencing unsheltered homelessness. Establishing an appeals process that includes a hearing before the Human Services Board and an option for an expedited appeals process. Expanded use of 211 within the intake system. Whether continuation of an emergency shelter should include an expectation regarding household participation in case management services or other expectations, such as night limits on the use of hotels and motels, and if so, what elements and in what circumstances participation in case management services or other expectations should be applied. Whether the use of emergency shelter should include financial participation, and if so, what participation should include. How best to ensure that there is equitable access to shelter and supportive services for households experiencing homelessness. And any anticipated challenges requiring a legislative solution. So that is part 2 of the report. I know.
glad I'm not on my committee. That's a lot of work.
So those are reports coming from the department. They're being informed by community action agencies and the network.
Mhm.
Now we're transitioning to talk about interim and final VHART implementation plans.
Yes.
I don't want to call them region needs assessments. Maybe can I flag that for myself? If we have 2 implementation plans, we're gonna all be confused. Let me take that one through. Prior to the enactment of VHART on July 1, 2026, the community action agencies shall conduct initial regional needs assessments in accordance with the process developed in section 7A1 of this act. What is 7A1? That is the October 15th report where you're asking the department to come up with performance measures and a process for what regional needs assessments, how they should be conducted. So you're referring back to the work that has happened in October. On or before January 15th of 2026, the Community Action Agency shall submit 1 comprehensive progress report, including estimated fiscal year 27 budget needs and estimated administrative costs. On or before April 1, 2026, so 3 months later, the Community Action Agency shall submit 1 comprehensive report detailing the results of each region's regional needs assessment and implementation plans, which shall not exceed the budgetary estimates provided in the progress report. The initial needs assessment conducted pursuant to this section shall include. I'm going to pause there because we don't say who the report is going to.
I was just gonna ask that.
Yes, we have to add that in. So I'm assuming Human Services and Senate Health and Welfare. Maybe the pros committees want it too, if it's.
Yeah, I think there, a lot of this is gonna be, sort of kind of fiscal analysis and,
Okay,
yeah.
I will make that change. So this list you've already seen once in this bill. This is in the codified language about what is part of a regional needs assessment. But because that portion will not be codified yet, I've added it here so that it will guide and govern the initial regional needs assessment that would happen. So I won't go through this twice. Which means we can jump ahead to page 25.
So what, October on page 25, so what I'm gonna suggest is Jen is coming down so we can look at 266 and she may have to be upstairs.
Do you want me to pause here?
This would be a good place to pause
Sure.
briefly and we'll come back. We are then moving on to page 25.
Perfect.
So this is a good place to end for now and we'll just